Hey, what's going on? Dr. Taylor, Aspire Chiropractic. Today, let's talk about the different types of disc issues we got. D-I-S-C. What's a disc? What's it doing? How's it hurt me? How's it help me? What's a herniation? What's a bulge? What's a sequester? Just what's the what? Okay. So, anatomy. We're gonna start way over here. Okay. So this. Primarily, think of these as lumbar vertebra, right? I mean, you can get disc issues freaking anywhere, but more often than not, they're going to happen in the lumbar vertebra. Why in the lumbar vertebra? Lumbar is the low back vertebra. They're the ones that carry all the weight, right? You got 5 of them down here. You got 12 in the middle in your thoracic. You got 7 in your neck. But obviously, the 5 in the low back are carrying everything from above, right? So if we take this as our primary diagram, our primary example, and we've got our disc right here in between the bones. Okay, we've got discs between every single bone in our spine except your skull and C1 and C1 and C2. Every other bone in your spine has some discs going on in it, right? One disc per bony junction, if you will. Do this so that way you've got a whole bunch to look at. So we're going to leave this here. Bone, disc, bone, disc, bone, disc, bone, disc, bone, disc. Now, what we're looking at, again, this is the back. Obviously, it's the back spine chiropractor. This is the low back. This is the front. Here's an eyeball. You're looking that way, right? So this stuff back here is your back. Now we go here, running down the back of the spinal cord, back of the spine, is the spinal cord. And coming out from these lateral foramen. Foramen is it's either Greek or Latin. It's an old word meaning hole. It means old hole. No, it just means hole. So we've got these lateral foramen here where these nerves come out. Now this is all important. And then right in here where the spinal cord goes, this is the central canal. So what we're going to do, we're going to take this disc right here and we're going to look at it from above. So let's say we're looking like that. That's the center of the disc. It's called the nucleus. You might remember the nucleus from like high school science class. All I remember is the mitochondria is the powerhouse of the cell. Nucleus was another part of the cell. And then around the nucleus is the fibrous tissue that makes up the disc. It's called laminar tissue. Basically, laminar just means layers. This sits, remember, we're looking straight down the top, so we can envision the bone like that. Like that. Here is the central canal. These here are going to be the transverse processes, just means bone poking out sideways. This is the spinous process. So, once again, that's the front. Here's the back. We're looking straight down, like straight down your spine. So, if we've got our disc here, our disc has 2 parts, the fibrous outside and the jelly in the middle. That's a good disc. That thing can bend and move and twist, right? We should have nice, thick, fat, healthy discs. Now, what can happen? This jelly in the middle here, this nucleus, it can start to bulge, if you will, into or herniate into, because hernia, what is a hernia? A hernia is just when a thing goes into another place, okay? So if you are in your bedroom and you walk into the living room, you have herniated yourself into the living room, okay? So if we've got our nucleus here, and the nucleus, this jelly in the middle, starts to work its way between the laminar layers, between the layers of the discs, what that's going to do, that's going to take up more space, and it's going to push this stuff out. Now, what we're looking at here, it rarely goes directly out to the side. So again, if we're looking from the top, this is going to be the right. Rarely does it ever just go straight to the right. Why? Because that'd be way too easy. So we're going to go back here. We've got our spinal cord here like that. And that is the path of our nerves. So where does our disc more often than not bulge? It bulges backwards, right? So we're going to say this jelly is kind of leaking into here, which causes the border of this disc to do something like that. And again, as of right now, this is not a huge deal. This is going to cause localized back pain. This is going to cause, I got a thing right here, okay? It's not, rarely is it going to cause anything above, below, left, right, or to the side. This is going to be generalized, localized back pain. The issue happens when this jelly here starts to push the disc material on and it starts to hit that nerve. When it hits that nerve, that's when things start to get tricky, okay? Because especially here, if we're dealing with the low back, these nerves that come off, where do they go? They go down to the hip, they go down to the leg. It's called what? Sciatica. Exactly. So this disc material, the jelly stuff, pushes on the layers. The layers start to bulge out, causing a disc bulge. And then the herniation occurs when this stuff here gets out of the disc, right? It gets into this area here. So what do? Fun fact, a grand majority of disc issues will go away on their own. It is self-resolving. The crappy part about it is it takes months, potentially years, but they do go away. So you come in, hey, I've got this localized back pain. Okay, cool. Or I've got this pain going from my back into my hip, or going down into my hammy, or God forbid, all the way down past the knee into the foot. Long story less long, kind of rule of thumb. The further the pain goes, the bigger the issue you have, okay? So we've got the nucleus herniated into the disc material, pressing the disc out, touching on that nerve. That nerve is, let's say it's L5, which makes up part of the sciatic. It's a sciatic nerve, lightning down the leg. How do we fix this? You at home, do cat-cows. It's get on all fours and flex and extend that low back. What you're doing is you're pumping that disc to get that disc material to reabsorb. It will do that. Your body will fix itself. And if you can do little things to make it work better, cool, go do those things. Next thing we do, go to a chiropractor like this guy. I'm really good. You assess the vertebra of the spine to make sure these joints are moving properly. Because if we've got a joint here that's got a herniation, but this joint can't move, you can do all the cat-cows you want, all the pumping you want with that low back and hips, and that's not going to fix that disc if this joint can't move. So we assess the bones in the low back to make sure that they're moving, mobile, and if they're not, we make them move. Next, what do? We do decompression. So more often than not, we take a look at this on an x-ray. These two bones are going to be a lot closer together than the ones above or the ones below. But the thing is, your disc material hasn't gone anywhere, right? If this is thick and this is thin, this disc material, it didn't just vanish, it just got displaced. So what do? We do decompression. We stretch the spine along the y-axis, one of them, or along this axis here, to increase that disc space, to help that body reabsorb that disc material. It literally will suck it back in. If you listen real close, you might even hear the sucking sound. Probably not. That's a lie. Don't turn me in for misinformation. But we create a vacuum. We create a negative pressure in that disc space through decompression to help the body resorb that material. That herniation goes away. Then all of a sudden, that nerve pain goes away. And the best part is, you didn't have to have anyone cut you open. You didn't have to go get spinal surgery, which, you know what the great part about spinal surgery is? It works 50% of the time. You know what the crappy part about spinal surgery is? It works 50% of the time. You know what the really crappy part about spinal surgery is? You don't know which side of that 50% you're going to land on. But legit, go look it up. It is not successful as far as surgery is concerned. But through safe, natural chiropractic care, decompression, non-invasive, we can allow the body to resorb disc herniations, taking pressure off those nerves, getting rid of sciatica, allowing the disc to heal itself, allowing the body to move better, work better, allowing you to live better, be happier, make more money, all those things. Go out, praise your chiropractor, tell your friends how great he is, and then everyone's happy. Why? Because your chiropractor do a fun little drawing on a whiteboard. But no, if this sounds like something you got, or something that you know someone who's complaining with, again, that localized back pain, that might kind of shoot lightning bolts out into the hip, or again, further down the hammy, down to the leg, in the foot, things like that. They got sciatica type issues. If you've Googled it and you know what you have, cool. Can you fix it? Probably not. Cat-cows will help, but we got to get these bones moving right. We got to get this disc material resorbed back into the spine, and we've got to do it without drugs and surgery. Because there's not a single pill in the world that'll move a bone, but there are plenty of surgeons that are out there that'll cut you open and give you a 50-50 shot. You walk through that door. We're ready to help you when you're ready to be your best. Naturally, right here at Aspire Chiropractic.